As we get closer to the distribution of a COVID vaccine, today we officially learn who will get it first and the realistic number of doses that can be delivered. Our Jessica Aguirre joins us with some key decisions made just this afternoon. Jessica.
Yeah, they are pivotal decisions, Janelle. An advisory panel for the CDC met today and made an important decision on who's going to get vaccinated first. And as you might expect, those important vaccinations are going to go to healthcare workers. The panel voting 13-1 that healthcare workers and those living in nursing homes should be first in line. Now, here comes the sobering reality of this. Those two groups make up roughly 24 million Americans. No more than 20 million doses of each vaccine will be available by the end of this year. Each vaccine requires 2 doses, so do the math. It's really sobering. Still, NBC News science contributor Dr. Joseph Fair says seeing frontline workers get vaccinated may actually be the key to getting everyone on board of eventually getting vaccinated.
All I can say is that I hope that it will encourage them. No matter what evidence we have presented over the last 2 decades to the quote-unquote anti-vax movement, that vaccines are not associated with autism and other, deleterious effects. They seem to be growing only in the movement. And so there's a lot of people already hesitant to take even normal vaccines that have been around for, in some cases 50 years. And so it's going to be hard to get those same individuals to want to sign up for a new vaccine.
So are you seeing the timetable for this vaccine rollout much like we were talking about like 6 months ago, that it'll be by the summer of 2021 that we'll have most of the country vaccinated of those people that are willing to take the vaccine?
Yeah, I think it's going to be around summer of 2021 before your average American is vaccinated or has the option to be vaccinated. Just because there's a lot of work to do between now and then, both in terms of vaccine production, distribution, who's going to be able to give it. Are you going to just give it, at the doctor's office, or are you going to be able to get this at the pharmacy and things like that with the flu shots?
So there is some conversation about whether they'll give the vaccine in some non-traditional settings like either a dentist's office or an eye doctor setting. But Dr. Fair believes that most people are going to be wary of doing something like that. They're going to be more comfortable getting it at the doctor's office or at a pharmacy like we're used to. He also says that because there is a trickle effect to this vaccine, since not everyone's getting it all at once, it'll be better for most Americans to see other people getting the vaccine. They'll be able to see whether people have some side effects or not, and that may increase people's likelihood to have everyone get the shot eventually down the road.
It's going to happen fast. Thank you, Jessica.